We are here with Morgan from Assisting Hands Home Care. Thank you, Morgan, for joining Taking Care of Mom and Dad.
Thank you for having me.
So I'd love for you to tell us a little bit about the company, how it got started.
Absolutely. So Assisting Hands here in Fort Myers is actually the first franchise location that opened up back in 2007. And in 2021, it was purchased by the new owners, Tim and Andy DeCenzo. Um, Tim kind of had an entrepreneurial spirit, and he wanted to run a business that made an impact on other people. And Annie had kind of seen firsthand the stresses that come along with caring for a family member and watching her mom take care of her grandmother. And so they've worked really hard to make a lot of changes since they came in and really make the company what it is today. Really trying to allow people to age at home in the company of their own home with dignity, and give people peace of mind that are living, farther away, knowing that their family's in good hands.
Yeah. So that's good that they have firsthand experience in that. And that's what drove them, right, to start.
Yes, absolutely.
To know what kind of services your company offers.
So we do a lot of assistance with personal care type things, showering, grooming. We can help with dressing. Our caregivers do some meal prep. So if, a lot of elderly, it's difficult for them to stand in the kitchen for long periods of time. So they can kind of help with that process to make sure that they're getting the proper nutrition. They can also run errands for them or even just get them out of the house if, they want to go out to lunch or want to go for, a walk at the park. They can get them out of the home and get them into more social situations. They also do some light housekeeping. Some of the day-to-day stuff can be difficult to keep up with when you're not able to ambulate well. And just general companionship, to help with the isolation that kind of comes along with some of the challenges that come with aging.
I have a lot of families that ask about the process of how you hire your aides and how they're trained.
Okay, yeah, and I do think that's one of the ways that we kind of stand out from other companies. So our HR recruiter, her name is Rhonda. She was actually a caregiver with us for about 9 years before she took the HR position. So with her experience, she's really good at finding good quality caregivers. She knows what it takes, knows what we are looking for. And so once she's hired them on, then they actually come sit with me for their skills test and skills training. We are considered a non-medical company. Well, a lot of non-medical companies out there, they don't really dive into the medical side at all. However, we want our caregivers to kind of be prepared for some of the situations that they might come across in the home. So when they sit with me, we go over, the normal things like ambulating people and bathing people and things like that. But we also go into some diagnosis specific stuff. So we talk about, what are you going to do if you have an Alzheimer's client who gets combative or aggressive, the proper ways to handle that. Or if, your client has a seizure while you're with them, what actions you need to take to make sure that they're safe and they don't hurt themselves. We talk about diabetes and low sugars. We talk about the signs and symptoms for stroke and heart attack. And of course, how to take care of them after they've had a stroke and help with that learning process as they're learning, to function in a totally different environment. So we really try to prepare them for some of those scenarios they might come across. Even things like all of our caregivers are CPR certified, but one of the things that they don't teach you in your CPR class is what if your client is in a wheelchair and they've gone into cardiac arrest? You need to know how to get them out of that wheelchair safely without injuring them or injuring yourself. So those are just some of the things that we cover so that hopefully when they come across some of these emergency situations, they know the proper actions to take.
That's a great educational program, and having them know that information is very key. Another question, I noticed on your website, you go, what I liked about your company is you go from the beginning all the way through to the palliative care. What does that involve?
Yeah, so I mean, we do anything from a simple companionship case to someone who's totally bedbound and needs, complete care. And we do partner with some local hospice companies. Hospice, some people believe that hospice is there kind of 24/7 for you at the end, but that's not always true until the very, very end. So we're able to kind of sit with them and be with them in between when hospice is not able to be there. And I do, when I meet with them, that's one of the areas that we really go in depth to kind of prepare them, not only for some of the things that they're going to see and come across, and to prepare them for the losses. It can be difficult for the caregivers as well, especially if they've gotten to know their client and lose their client. So I try to prepare them for some of those things. And we talk about, some of the things that are really important for those bedbound clients. Simple things like making sure that, we're turning them every 2 hours and they're watching for skin breakdown. We, talk about things that they can do if they're struggling to breathe. A lot of people towards the end, they get unusual breathing patterns, or that what they call the death rattle, that awful hacking cough. So I try to not just warn them about those things, but give them tools like raising the head of the bed, turning a fan on to get the air circulating, just little things that they can do to kind of make things easier for the client as well.
So you brought out a good point about hospice, because I think many people feel that once they enter into a hospice program, it provides that 24-hour care, but a lot of hospice doesn't. They do a lot of the nursing part of it, and they come in for a couple hours, and that's where your company can come in between
Yes,
time,
that's correct. Yeah, they generally will come in, they do the more of the medication management. They make sure, if they do have skin breakdown, that those things are being addressed. But a lot of times those hospice patients, especially if they're bedbound for a significant amount of time, they really need someone there making sure that they're turned every 2 hours and they're staying clean and they're staying dry. And even just being there for the moral support. Going through hospice can be a really isolating situation. A lot of family, they don't like to see their loved ones like this, and it can be very isolating for the patient. So even just having someone there to hold your hand and to vent your feelings and your frustrations to is really important.
What would you say is a lot of companies have a philosophy or a mission statement behind them. What would you say your company is?
Well, we believe that, people should be allowed to age at home in the environment that they're comfortable with and that they're happy in. And our company allows them to do that and to do it with dignity. We love that we're able to give families peace of mind, knowing that, their family is in good hands, knowing that they're being taken care of properly. We pride ourselves on the communication aspect. I think we're very good at keeping everyone kind of in the loop. Our caregivers report to us. We talk with the family, everybody. We try to make sure everybody always knows what's going on. We collaborate with their other physicians if they give us permission to do so. And so we try to make sure that it's a closed unit and everybody is aware of what's going on and what's being done about any issues that come along.
And what areas do you service? I know you're out of Florida.
So our location does all of Lee and Charlotte County. We are a franchise, so there are a few other locations. There's over 100 nationwide, but our territory is anywhere in Lee and Charlotte.
You had mentioned about you reach out on Facebook. Can you tell us a little bit about that, how you help families?
Absolutely. Just a few weeks ago, we launched a new Facebook group called Assisting Seniors Lee County. And I kind of had two ideas in mind when I started that. Since I've been with Assisting Hands, I've come across an abundance of resources out there for seniors. But I found that just a lot of people just don't know where to find them or where to look. And they struggle with finding the right people to ask the right questions. So our group is a place where all of our partners kind of come and they can network and market with one another. But it's also a place that seniors in the community can come and they can ask questions and find resources for various things in the community. So we're trying to kind of bridge that gap and, educate the public as well. Pretty much every day we have some sort of educational post on there that has something to do with seniors or senior care as well.
And how would we reach that? Is it
Assisting Seniors Lee County, our group will pop up.
Oh, wonderful. Okay. So I will actually leave that link below for them. Thank you, Morgan, from Assisting Hands Home Care, for sharing what your company does with us and sharing your story with us.